Welcome to Med-Surg Tutor, and in this video we'll be going over some practice questions for medication administration. So question 1, a nurse is administering a subcutaneous injection of insulin. What site is the best choice for this route? So already we know for subcutaneous injections we should be thinking of the fatty layer of the body. So A would not be the answer because deltoid is an IM injection. B would be the answer because that is the fatty layer of the body, and this is where we would typically give insulin. C and D are also places where we would typically give an IM injection. Question number 2. A nurse is preparing to administer an oral medication. Which action should the nurse take before giving the medication? A. Crush all the tablets for easy swallowing. B. Ask the patient if they have difficulty swallowing pills. C. Give the medication with grapefruit juice. Or D. Administer the medication immediately before a meal. So already we know that A and C won't be the answer because we can't crush all medications. Some medications are enteric coated or they're sustained release, meaning that they need to be swallowed whole for it to be effective. We also know C wouldn't be the answer because some medications aren't compatible with grapefruit juice. And then D, administer the medication immediately before the meal. Well, we don't have all the information to answer this question. So the correct answer choice will be B. All we know is that this is an oral medication. So before we give it, obviously we would want to know if the patient can even swallow the medication. So the correct answer will be B. Question 3. A nurse is preparing to administer an antihypertensive medication. What vital signs should the nurse check before giving the medication? Before we answer this question, what does antihypertensives do? They lower the blood pressure. So here we need to assess before we give this medication. So once you know what the medication does, you would know what you need to assess for, which is B, blood pressure. Question 4. The nurse administers an IV antibiotic to a patient. Within minutes, the patient reports swelling of the lips and difficulty breathing. Which of the following is the nurse's priority action? So after giving this medication, the patient has swelling of the lips and they're having trouble breathing. This sounds like an allergic reaction, but let's go through the answer choices. A, document the allergic reaction and notify the healthcare provider. So we know it's an allergic reaction, but typically documenting is the last thing we would want to do. It's obvious that this patient cannot breathe right now, so we would want to go ahead and put in some interventions. B, administer an antihistamine and continue to monitor the patient. Well, this patient is having difficulty breathing and swelling of the lips. And this isn't a normal reaction to an antibiotic. So we're not going to want to give an antihistamine because this is an allergic reaction, and we're going to want to do more than just monitor the patient. C, immediately stop the infusion, maintain the IV line, and administer epinephrine as ordered. Yes, this is going to be the correct answer because 1, we're giving this medication via IV. So we're going to want to stop the infusion because clearly the medication isn't responding the way it should be responding. We're going to also want to maintain the IV line just in case we need to give some emergency meds for this patient. And then we're going to want to give epinephrine because this is an allergic reaction. This is what we'll typically give for a reaction like this. And D is irrelevant because asking the patient to lie down and monitor for any changes isn't really taking any action for this patient. Question 5. The nurse needs to dispose of a used syringe after administering an injection. Which of the following is the safest method? A. Recap the needle and place it in the sharps container. So we never want to recap a needle because it brings risks to the nurse. So if you give an injection to a patient and you recap the needle, you can accidentally stick yourself as the nurse. B, place the syringe in a regular trash bag. We definitely don't want to do that because we have a container specific for the sharps. C, immediately dispose of the syringe in a designated sharps container without recapping. This is the answer. 1, we're putting it in the correct spot, and 2, we're not recapping needles. Or D, dispose of the syringe in a biohazard bag. So we wouldn't do this because it's a syringe. This isn't the correct place to dispose of the syringe. Question 6. The nurse is preparing to administer a high alert medication. Which action should the nurse take before administering the medication? Verify the order with the patient. Well, the patient is the person we're giving the medication to. They didn't prescribe the medication, so obviously A is incorrect. Double check the dosage calculation with another nurse. Now, this seems a little bit more accurate. This seems like a possibility. It's a high alert medication, so we don't want the patient overdosing because the risk with giving the wrong dose can be very severe. C, ask the patient if they're allergic to the medication. Well, you should have already checked the chart before giving this, and this is more of a high priority question. D, administer the medication only after the physician has signed the order. These C and D is irrelevant to the question. The correct answer would be B. So with high alert medications, we always want to check the dosage count because what? Safety. We want to minimize harm to the patient. Question 7. A nurse is teaching a diabetic patient about insulin injections. Which statement about insulin site rotation is correct? A, you should always inject insulin in the same spot to avoid irritation. Well, this is false because there's going to be a possibility of lipodystrophy. You don't ever want to keep injecting in the same spot. B, rotate injection sites to prevent tissue damage and improve absorption. This is correct, especially with patients who take insulin regularly. You will always want to rotate those sites. C, inject insulin into the muscle for faster absorption. This should automatically be incorrect because where does insulin go? Into the subcutaneous layer, not into the muscle. D, avoid rotating sites for a month to allow medication to work better. This is just bad practice. You always want to rotate the sites. Question 8. A nurse is administering intramuscular injection into the deltoid muscle. What is the correct technique for this administration? A, inject the medication at a 45-degree angle. Well, this will be false because we will only do this for the subcutaneous injections. B, palpate the greater trochanter to locate the injection site. This isn't quite right. C, use a 1-inch needle at a 90 degrees angle to the skin. This is the answer. Or D, inject the medication into the lower leg. So the lower leg will be the ventral gluteal site, not the deltoid muscle site. So that is why D is incorrect and C is correct. We want to use that 1-inch needle, so we're making sure we're putting it into the patient's muscle in that 90-degree angle to ensure it's at the right location. Number 9, a nurse is administering medication and notice it is in tablet form. Which medication should the nurse not crush? A, enteric-coated tablet. B, aspirin tablet. C, regular release antibiotic tablet. Or D, chewable antacid tablet. So automatically we know it's not going to be D because a chewable tablet, the patient is going to chew that tablet, which is basically crushing it. A regular release antibiotic is just a regular antibiotic, so it's not sustained release where the medication releases at different intervals, so they can crush that. An aspirin tablet, normally you can crush that. So the correct answer will be an enteric-coated tablet, meaning that the medication can be destroyed by the acid in the patient's stomach. So we want to make sure that they swallow it whole so that medication is effective. Okay, last question, number 10. The nurse accidentally administers medication to the wrong patient. What is the nurse's next best action? A, document the error and continue with the current shift. Remember guys, document it is typically the last thing we want to do, especially in a case where we just made an error. We will always want to have the patient safety be the number one thing on our mind. B, immediately notify the healthcare provider and follow the facility's incident reporting protocol. Okay, this sounds like it will be more accurate, but let's look at C and D. Wait until the end of the shift to inform the supervisor. Well, you just put the patient at risk by giving them the wrong medication, and you want to wait till the end of your shift to do something. This doesn't seem right. So definitely not C. That's not safe at all. D, administer the correct medication and withhold any documentation. This just screams a lawsuit. If you made an error, you always want to correct and document it. But here, you're not documenting it, and then you're going to give them the correct medication, meaning you're not even going to correct the error you made. So the correct answer here will obviously be B. Immediately notify the healthcare provider and follow the facility's incident reporting protocol. Alrighty, guys. Happy studying. This was the last question.